Welcome to Dr. Baliga's podcast for the Curious Doc. This videocast is on a New England Journal of Medicine article titled Molecular Evidence of Multiorgan Damage in Patients with Immune-Related Adverse Events, published December 10, 2025. Today is December 17, 2025. Immune checkpoint inhibitors cause immune-related adverse events affecting multiple organs. Detection relies on clinical recognition. No molecular surveillance exists. This study was a prospective observational correspondence study. Sample size 14 patients with solid tumors on immune checkpoint inhibitors. 6 had clinically evident immune-related adverse events. 8 without immune-related adverse events. Timeline, baseline pre-therapy, and follow-up was at about 4 to 8 weeks. Technique, genome-wide cell-free DNA methylation sequencing was utilized. 9 organs were assessed: heart, lung, liver, colon, pancreas, brain, adrenals, esophagus, and small intestine. Fisher's exact test was used for statistics. Tumor burden assessed via copy number alterations. What did they find? 6 out of 6 patients with immune-related adverse events showed molecular multi-organ damage versus 0 out of 8 without immune-related adverse events, p-value 0.001. The median increase in tissue-specific DNA, cell-free DNA, was 6.1-fold. The damage preceded clinical diagnosis in 3 patients, 4 to 236 days. Multi-organ involvement exceeded clinically apparent organ toxicity. Limitations of the study: this is a small sample size, a pilot study, short follow-up, potential confounding from subclinical infection. Key takeaways: immune-related adverse events reflect systemic immune loss of tolerance. Molecular injury precedes symptoms. Clinical immune-related adverse events are the visible tip of the iceberg. Clinical pearls: cell-free DNA methylation enables organ-specific injury detection. Subclinical organ injury is common during immune checkpoint inhibitor therapy. Early molecular signals may guide preemptive intervention. Cardiac involvement can occur without overt myocarditis symptoms. This supports reframing immune-related adverse events as systemic toxicity syndromes. These are some eponyms related to this study. Hit pause and read at your leisure. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.